report by UNAIDS finds that HIV and AIDS can be eradicated when there is political will. The organization says initiatives to end the pandemic need to be adequately resourced and use approaches that are inclusive and rights-based. Some of the countries that are doing well in handling HIV include Botswana, Eswatini, Rwanda, Tanzania and Zimbabwe. Joining us now is Githuku-Shongwe, who's the regional director at UNAIDS. A very good afternoon to you. Thank you so much for your time. Perhaps the most critical question to ask now is, what does the path to end AIDS look like for Southern Africa?
Thank you so much and good afternoon. Just to say that we are so proud of the countries in our region who've been able to show this significant success, and we will follow their path. And their paths really include four major areas. The first is that we have the data and the evidence that tells us who is infected, what areas, at a granular level. We know in Botswana, we know in Eswatini, which province, which district, who is infected the most. So when we follow the data, we follow the science, we follow the evidence, that is one of the key issues that we think about as we talk about this path. The second one is to tackle inequalities. The issue of gender inequality and girls and young women who are highly vulnerable to HIV infections, key populations, these are men who have sex with men, female sex workers, people who inject drugs, who are highly vulnerable to HIV. We have to tackle those inequalities as well. The communities themselves who are engaged in services for themselves, people living with HIV, play a vital role. And the more engaged they are, the better the path. And then eventually we have to focus on this issue of sustainable financing. In countries like Botswana, like South Africa, Namibia, even in Eswatini, the governments are providing significant funding for the AIDS response and less dependency on external funding. And so where there is these four major key areas, then we know we're on that path. And we're seeing this in Botswana. In a country like Botswana, we've also seen that where in other countries children are lagging behind in terms of treatment, Botswana has been recognized as the first country in the world to really lead on ensuring that we are eliminating mother-to-child transmission.
Yeah.
So it's on that path.
There are widening gaps in prevention and treatment between adults and children. Why is this so in Southern Africa, and how do we now reduce the gap?
There are multiple issues. These issues of gender inequality I talked about, that's a big issue. So we certainly see that, the young women, many of them who are mothers and teenage mothers, themselves have children who are in very vulnerable situations themselves. And so their ability to ensure that they are on treatment becomes difficult when they're in situations of hunger. So where there are those inequalities, that already complexifies the ability of the children themselves. In Southern Africa and across Africa, actually, we have a campaign that we call the Global Alliance to End Pediatric AIDS. And in that alliance, we're looking at key pillars. The gender inequality one is a big one, but we're also looking at finding where the children are and identifying what are the reasons why they're left behind, whether it's a question of enrolling schools, working with church leaders, working with, mentor mothers. There's all kinds of community programs that we have to be able to push from city to city, from region to region, to find the children who are not on treatment and enroll them and sustain them there. We have such large numbers of orphan children in our region, and many of them who have been born with HIV very often are very vulnerable, and so they too fall off. And are not able to sustain their own treatment. So being able to find them and make sure that they're on a pathway to sustainable treatment is part of our package in this global alliance.
If we have to look at South Africa, the country has a very high teenage pregnancy rate. What initiatives are available to reach adolescent women and young girls?
The truth of it is that this issue is not unique to South Africa. During COVID, we found that country after country in our region were experiencing high levels of teenage pregnancy. Teenage pregnancy for us is reflecting the inequalities that I raised. You know, the issue of blessers continues. And being able to ensure that girls, on their part, are, have the kind of comprehensive sexuality education that helps them to recognize where their vulnerability is coming from is important. Of course, dealing with the economic vulnerability that's a reality for many of them. Even something as simple as food already, access to food already makes a difference for young girls being engaged in risky behavior. But we have to deal with the fact that, toxic masculinity and patriarchy, the issues of men themselves who are taking advantage and exploiting girls is a major one. So we are engaged with men, and we have strong programs that are engaging men, some with churches, some with just community organizations. There are many men's organizations increasingly that we're working with. So we have to work on both sides to be able to deal with those who are impregnating the girls and the girls themselves recognizing what their risk is. And so there are initiatives, but it's not enough. And we have to invest in a significant way because this is where the new infections are coming from. The teenage pregnancy is just telling us about unprotected sex that's taking place in that population group.
Absolutely.
It's a real crisis in our region. It's not just Africa.
With the facts at hand, the impact of COVID-19 and some of the research showing to some of the points where there's an increase and the young girls as well as teenagers indicating a bigger picture, what is needed then to end AIDS as a public health threat by the year 2030? And how are we faring as you speak about some of the challenges that we're currently facing?
So I think the big thing is that in this region, we've done exceedingly well in terms of our treatment agenda. Of course, a country like South Africa becomes a major challenge because of the large numbers. We have over 8 million people living with HIV. Over 5 million of them are on treatment, but we still have 3 million odd who still need to get onto treatment. And the more that are on treatment, the higher the probability we have that they're virally suppressed and are not able to transmit to others. And so the issue is a systems one, right? So it's not, we target the young people with comprehensive sexuality education, with the tools that they need to be able to prevent for themselves. We turn attention to investing in prevention in general. And prevention means that recognizing what are the vulnerabilities that they have. How do we keep girls in school? This is a major issue that we're working with. We have an initiative called Education Plus. And Education Plus is designed to ensure that every girl finishes secondary school across the region. We have evidence that when girls finish secondary school, the chances of infection are 50% better, chances of them not getting infected. And with boys, obviously, as you're doing that comprehensive sexuality education as part of this Plus package, the boys are also educated and start making better choices. So for young people, education, access to sexual and reproductive health services, including making sure that their age of access is in line with the reality of the lives that they lead, because they have to be able to access these services at a young enough age. Being able to ensure that we're preventing violence. As you know, GBV is a big issue in our region. And so, it actually drives HIV very, very extensively. And so all of these structural barriers on the one hand, but ensuring that prevention tools like condoms, like PrEP, where it's possible, where we've got high vulnerability, that we are able to ensure that the full package is available for young people, and for them to just strengthen their agency. Young people are really, really, really powerful in terms of their own prevention when they have stronger agency. So investing in their organizations, investing in them and their movements really become a big part of the answer. Yeah. And this is what we're working on.
Very well. Thank you so much for breaking that down. And Githuku-Shongwe, Regional Director at UNAIDS there.